Good evening, my dear students. Today we are discussing about one more topic in genetics. Topic name is neural tube defects and what is the role of folic acid in the neural tube defects. So this is our today topic. So what is the neural tube defects? First of all, what is the neural tube? So neural tube is a presence in the brain and spinal cord regions. So here mentioned the neural tube is the embryonic precursor to central nervous system, which is made up of the brain and the spinal cord. That is a neural tube. That neural tube is defected by the covering the brain and spinal cord is called as a neural tube defect. Actually, it is one presence in the brain and spinal cord. So this one is it covers the brain and spinal cord total area out of the circle of brain and spinal cord is covered by the this neural tube. So some mental retardation problems, developmental delay problems is develops. So here this is the one of the birth defect also. By birth this type of defects is occurred in the body. So here this one according to the Steinberg, scientist named Steinberg, neural tube defects are the birth defects of the brain and spinal cord or vertebrae. These are the locations: brain, spinal cord, or vertebrae, whatever it's. So neural tube defects are neural tube defects are mainly it caused by the one factor is the environmental factors, like a mother suffered from the diabetes, obesity, and addicted to the drugs or whatever it may be. And one more main reason is folic acid deficiency. Due to the folic acid deficiency, these are the factors: diabetes, obesity, drugs is the factors. But this folic acid deficiency is also main problem to develop the neural tube defects. So which type of characters is observed? Here we observe the one character. So in this gap there is no vertebrae. Just check once. So in the given structure there is no vertebrae. Which area like this? Just check this point. This area, in this area there is no particular vertebrae in this area. Just check this. So this one is one of the problem. Sometimes this type of characters is developed, this type of characters is developed. So these characters is considered as the two this considered as the neural tube defects. Neural tube defects. These neural tube defects are how to occur in the body due to the some reasons. That reasons is the these are the reasons: diabetes, obesity, are addicted to the drugs, or folic acid deficiency. These are the create the some problems in the brain and the spinal cord. Just check this neural tube defect is defined as a failure of the closure of the neural tube during at which condition, at which time. So this one is occur mostly third and fourth week of the pregnancy. So in the third and fourth week of pregnancy, so the third and fourth week of pregnancy it creates the some problems related due to the deficiency of folic acid or some due to the some reasons. So mostly first month, within the 1 month this type of problems is develops. So this is about according to the Simon, scientist name is Simon. So neural tube defects are located in the brain and spinal cord and at the developed at the brain and spinal cord and vertebrae. And this one is due to occurred by the folic acid deficiencies, and the next one it is mainly occurred within the 1 month time. So now we'll go with the types of neural tube defects. Total three types is occurred in the body. First one is the enencephaly. And this enencephaly is characters are developed. First one is enencephaly. Second one is the encephalocele and spina bifida. These three are the These three are the types of neural tube defects. Now we'll discuss about one by one. First of all, anencephaly. Just observe the structure of anencephaly. First of all, just observe the structural difference between normal and abnormal conditions. So in normal condition, this is the normal brain. So normal brain is it occupies the total skull area up to forehead also. But in this condition, second condition, brain is not well developed. That is called as a no brain formation, or in case formation, little bit quantity only formation. Little bit quantity means 50 percentage, 30 percentage, 20 percentage only formation. Just check this. Anencephaly is a serious birth defect which a baby is born without parts of the brain and skull. Sometimes skull also not formation, not only brain. Anencephaly is a defect in the formation of baby's neural tube during the development. During the development means at the mostly first month. It is the type of neural tube defect occurs when head end of the neural tube fails to the close, characterized by the absence of major portion of the brain and spinal cord, brain and skull. So here, infants either die within the uterus, die within the few hours of after birth. Also means here mention the one main word. So that main word is, what is the main word? This characters is absence of major portion of brain and skull. Due to this one is it leads to the abortion. We die within the uterus. Fetus is the infants are either die within the, or otherwise after delivery within 1 hour or within the 1 day. Mostly it leads to the death after birth. Right? These type of characters are develops in the anencephaly. Now we'll go with the encephalocele. Encephalocele happens when the neural tube does not close completely during the pregnancy. Actually, in the brain and spinal cord formation, so this area, which area? So only this area is the brain and spinal cord is develops. Brain is and skull is formation. But due to some reasons, this one is not opens. Brain is not opens. So brain is developed in the part of the skull. Okay, encephaly happens when the neural tube does not close completely. The neural tube does not close completely. So here, so this part is going to changes their structure. So means this extra part is attaches to the main skull. Why? Because of in the development of brain, the neural tube is actually close in particular area, close in this area only. This area is only closes. But due to some reasons, whatever it may be, environmental factors, microorganisms, so this area is also extended. So this type of characters are develops, that is called as a encephalocele is the neural tube does not close completely during the pregnancy. So that's why it is extended. This head is extended. Neural tube defect characterized by the sac-like portion is observed with the open skull. This problem is rises due to the depends upon the genetical factors also. Now we'll go with the spina bifida. Spina bifida. Before go with the theoretical matter, just observe the what happened in the body part. The spina bifida is a develops depends upon the abnormal. Here mention the one point. So abnormal opening the vertebral column. Actually, remaining two is anencephaly, encephalocele. These two are the develops in the skull and brain. But this one is occurred in the vertebrae column. It's the occurred in the vertebrae column. In the vertebrae column, this one is this fluid filled sac is occurred, that is considered as a spina bifida. The spina bifida means vertebrae are open outside. Actually, vertebrae columns are fulfilled with the bones. We know that. So here one bone is there is no formation, yet that which bone is not develops, mostly C3 C4 at the ratio, the C3 C4 C1 C2 C3 C4 C5. So in this column one bone is not develops, so here fluid is replaced with that bone, so it opens or sometimes is extended to the outside also. This one is also it leads to the death and mental retardation problems, developmental delay problems is occurred in the baby. So now we'll discuss about just check this point at birth, which a developing baby spinal cord fails to develop properly. So here mentioned the spinal cord is not well developed, spinal cord is not well developed, and it occurs when developing baby spinal cord fails to develop and close properly within the in the fetus. These are the problems is occurred due to the spina bifida. This is about the neural tube defects, total three types of neural tube defects so is occurred. So this three types of and spina bifida also again three types. So spina bifida, occulta, and meningocele, and meningomycelial. So these are the three types of spina bifida. So this is about general characters and general characters and types of the neural tube defects. Now we'll discuss about etiology, which one is a causative agents. So etiological characters, just check this. So first one is right. So first one is a neural tube defects is are not known, and some are the genetical problems, nutritional factors, environmental factors, and the poor intake of folic acid and low level of the folic acid, obs of the woman, intake of anti-epileptic medicines at the duration of the pregnancy. These are the some characters these are the characters are occurred in the, at the duration of the pregnancy. It develops the neural tube defects. So here mention the some points related to the etiology. So first one is the genetical factors. So in the genetical factors here, so this neural tube is caused by the genes passed on from both parents, means inherited process, and genetic material abnormality presence in the parents, presence in the both parents, mother and father. These problems also creates the neural tube defects. Sometimes is a malnutrition means simply only one word, deficiency of vitamin b9. Vitamin b9, what is the vitamin b9? B9, it is the folic acid. So folic acid deficiency during the pregnancy, or poor diets lacking key nutrients like iodine, iron, folate, calcium, zinc. These also causes the some problems in the body related to the neural tube defects. And now we'll go with the environmental factors. In the environmental factors is parents both are one, smoking, tobacco intake or smoking, and metals, and inhaled anesthetics, and solvents, organic solvents, and air pollutants, and the next one, pesticides, agriculture related products, and radiation, affected to the radiation or mental stress also. These are the problems also effect on the development of fetus. It turn into the neural tube defects. These are the environmental factors. So the next one, poor intake. This is the very very important for you. Poor intake of folic acid. Poor intake of folic acid. So first one, within the first 28 days of the pregnancy, the neural tube is the mostly occurred, means within the 1 month, 30 days. Within the 30 days, these type of problems is develops. And the next one, this one is the adequate concentration of folate can prevent enclosure the neural tube. In case in perfect folic acid, 100% folic acid is vitamin b9 is a presence in the body. This type of problems is controlled. In case this percentage is decreased 50 percentage, 20 percentage, or 10 percentage, this type of characters of folic acid, it leads to the neural tube defect. So that's why here mention the poor intake of folic acids. And the next one, obese women and anti-epileptic drugs. These are the some problems is some genetical characters and some problems also is mentioned. Go with at least mention 3 or 4 points enough. Okay, this is the diagrammatic representation of the diagrammatic representation. Spina bifida is a total 3 types. We already discussed about this. So in this condition, first of all, here there is no bone formation, that is called as a spina bifida occulta, or here this one bone formation and extended to outside, that is called as a meningocele. And sometimes we observe the character, this this nervous system extended to these parts. So outside of the body, this area is occupied by the nervous system also. So this is called as a meningocele. Myelomeningocele. These are the 3 different types of spina bifida is occurred in the body. And what are their signs and symptoms? So signs and symptoms. So first one is the loss of bladder or bowel control, and the next one is the sensation, lack of sensation and a touch feeling like that. And the next one here, paralysis also is occurred, and weakness of the hip bone and feet in the baby. And the next one, some other problems also is mentioned. So here these all main signs and symptoms is it related to the developmental delay. Baby organs is not well developed before the delivery and after the delivery also, and the type of problems is develops. These are the some signs and symptoms. So what are their diagnostics? How to determination of the neural tube defects? So first one is the ultrasound, or then this is the main test. This is common for the every neural related or any other problems occurs in the entire duration of the pregnancy. Common test is the ultrasound. And the next one mention the some points also. Mention the some points. Wait. So maternal serum alpha fetoprotein test. This test is within the 20 weeks. We'll go with that. And amniotic tests also. And these are the some tests are mentioned. So by with the help of this diagnostics test, determination of the folic acid is perfectly presence in our body or not. These are also characters also to determination of the neural tube defects is presence in the baby or not. Right. Now we'll discuss about what is the role of the folic acid and how to when folic acid is decreases, how to develop the neural tube defects. So now we'll discuss about continuation topic. So here new folate or vitamin B9 important healthy fetal development. Not only vitamin B9, cyanocobalamin also, iron also, calcium supplement. These are the supplements are suggested to the pregnant woman from at the duration of the entire gestational period, after gestational period also. Why only suggested? So these are the support to the mother health and baby health also. That's purpose. One of the medicament is the vitamin B9. So the folate deficiency before the during the pregnancy. So means before the confirm the pregnancy in the mother, this folic acid is deficiency is occur. This type of problems is develops first of all. And the centers of disease control and prevention, CDC. So these are the this recommends the all people who can become pregnant to take the how much of vitamin B9, 400 mg, 400 milligrams of folic acid every day. So and every day this much of drug is suggested to the, and it helps to control as the NTD. NTDs means neural tube defects are is control. And then surgical management also is there. After this type of problems is developed, we'll go with the surgical management also. But as per our syllabus, we'll go with the folic acid. The folic acid is suggested, and this type of problems are mostly controls. So this is about today our topic, and tomorrow we'll go with the one more topic.